Good morning. My name is John Maynard, Shield Healthcare Senior Product Manager. Welcome to today's webinar titled Aging in Place, Tips for a Safe, Accessible Home Environment. Before we begin, just a few housekeeping items. Attendees will be in listen-only mode. If you have a question, please type it into the question box on the right-hand side of your screen. A PDF presentation is also available as a handout that you can download from the webinar. If you registered as a healthcare professional and would like to receive CE credit, look for an email from Capital Nursing Education containing your CE certificate within 7 to 10 business days. If you're watching this presentation as part of a group, please download the group CE handouts from the webinar panel in order for everyone in your group to qualify for CE credit. If you miss any portion of this presentation or would like to share it with a colleague, the webinar is being recorded and will be available on shieldhealthcare.com/community by the end of the week. We are delighted to introduce Kelly Sparks, RN, BSN, CWOCN, CFCN, as a presenter today from Capital Nursing Education. Ms. Sparks has been a CWOCN for more than 25 years and a nurse for more than 30. She's worked in wound, ostomy, and continence care for most of her career. Kelly has been on the board of directors of the Pacific Coast region several times in the past and on multiple projects for the WOCN certification board. She is active in the local Sacramento Walk Nurse Group where she serves as secretary. She has recently retired from Dignity Health but continues with her private practice. Kelly has been a speaker for many different conferences and classes. She enjoys speaking for Shield webinars and working with Capital Nursing Education to help promote education necessary for the care of patients. At this time, I'd like to pass the presentation over to Kelly. Kelly, it's all yours.
Thank you. Good morning, everybody. So we're going to talk about this aging in place, and there's a lot of information about this online, so with the references, you'll be able to appreciate that. So the objectives, first of all, we're going to talk about how this impacts the healthcare system. There are some very valid reasons why it does impact it. The fall risk assessment will look at fall prevention room by room and how incontinence relates to falls. There's some information about that also in the references, and community resources. So let's look at some not so fun facts about falls. It's very interesting that there are 50% of these elderly that fall are injured. And of those, 20 to 39% who fall will limit their activity later. Because of their fear of falling, they, tend to limit their activity, and they can definitely be affected with their whole quality of life is affected because they're afraid to do anything anymore. Some of the factors that contribute to falling are modifiable, and with help you can definitely modify them. The house, modify some of the other interventions you can do to keep from having them fall. There are intrinsic and extrinsic fall risk factors that we'll be looking at later in the presentation. So what type of impact do they have on our healthcare system? These statistics are according to the Centers for Disease Control and Prevention. $50 billion is spent on non-fatal fall injuries every year, and $754 million is spent on fatal falls. So as the number of Americans that are 65 and older increases, these numbers are the number of falls is going to increase, and the cost to treat these falls is going to soar. So that's a real huge impact that it has on the healthcare system. According to the Global Health and Aging Report presented by the World Health Organization, this number of people over 65 is projected to grow from an estimated 524 million in 2010 up to 1.5 billion by 2050. So the WHO attributes this to the life expectancy changes because it used to be that people died from infection, not from chronic non-communicable diseases, such as what it is now today. So these chronic conditions may include things like hypertension, high cholesterol, arthritis, diabetes, heart disease, cancer, dementia, and congestive heart failure. So heart disease, stroke, and cancer have been the leading chronic conditions that have the greatest impact on the aging population, especially the high-income countries. So in addition, the incidence of obesity and falls are increasing. So you can see how this is definitely going to affect the healthcare system as we all start aging. Speaking of aging, the baby boomers are now, those born between 46 and 64 are turning 65 by 2011. So 60% of them will have one or more chronic conditions. And then with this increase comes the increase of cost of treatment. There will be twice as many hospital admissions and twice as many MD visits by 2030. With falls being one of the most common causes of injury in the population, this is expected to be a challenge to our healthcare system. This is attributed to the fact that we're living longer. We're not supposed to live this long. We're remaining active, most of us, and possibly on medications that could lead to falls as well. So with the chronic conditions comes the medications. With the medications comes the dizziness, and it just continues on. So that is why people are falling more, because we're all getting older. So some of the challenges that are expected, with the increase in the population, like I said, there's going to be a lot of challenges. There's going to be new technology that comes along, and the increase of the cost of this technology, increase of training people with this new technology. The resource needs will increase. There's going to be a shortage. There could be a shortage of healthcare professionals. Federal program sustainability and structure are a concern. And, you know, changes in the family structure, that may lead to a lot fewer family caregivers, you know, coming along in age here. Due to the increase of the aging population, it will be even more important to develop strategies to prevent falls. The National Council on Aging, there's a lot of information about this agency, and it is in the resources, or in the end of the program. You'll have some information about this too. But according to the National Council on Aging, falls are the leading cause of fatal and non-fatal, like we've heard, because it shortens, or it threatens the seniors' safety and independence. They're overall more dependent on caregivers. So there's an enormous economic and personal cost involved in this, in these injuries. With practical lifestyle adjustments, evidence-based fall prevention programs, and clinical community partnerships, the number of falls among the seniors can be substantially reduced. According to, again, the U.S. Centers for Disease Control and Prevention, 1 in 4 Americans over 65 will fall this year. And every 11 seconds, an older adult will be seen in the ER for a fall. Every 19 minutes, an older adult will die from a fall. Falls are the leading cause of fatal injury and the most common cause of non-fatal trauma-related hospital admissions for the elderly. So you can see it's really becoming a huge issue. Now, the quality of life impact, let's think about this psychological effects of falls. Once they fall, they have a fear of falling again, and that leads to depression due to limiting their activities and their social engagement. So they become more homebodies. And limiting their activities can lead to further physical decline as well. And that too can lead to falls. So you see that vicious cycle that they get into. Overall, it impacts their quality of life. So it must be stopped before it starts, which means prevention of falls. I can totally understand this because I took a fall on my bicycle a couple of years ago, and it made it so that I was afraid to get back on my bike because my knee gave out and I fell, and so I'm afraid to get on that bike. I know what it feels like to be afraid of that once you do fall. The National Falls Prevention Resource Center is a part of the National Council on Aging, and it does many things to help with public awareness and to educate consumers and professionals about the risks of falls and how to prevent falls. They're wonderful. The NCOA is wonderful information. If you look into the references, you'll see that. They support and they stimulate the implementation, the dissemination, and the sustainability of evidence-based falls prevention programs. And so they come up with strategies to reduce the incidence of falls among your older adults and adults with disabilities. They also serve as a National Falls Prevention Resource Center. They have best practices. They bring out the awareness and education efforts and promote evidence-based falls programs. So every September, on the first day of fall, which happens to be my birthday, the Falls Free Initiative promotes the National Falls Prevention Awareness Day. And COA encourages states to become involved in this Falls Free event. More information can be found at, and it's again in the references, but ncoa.org/healthy-aging/falls-prevention. So if you want to look at that, that's quite interesting. You can actually bring it to your facility or to your town. Okay, so looking at several risk assessment tools are out there. The Johns Hopkins Fall Risk Assessment Tool is very, very easy to use. A lot of people use that. There's the STEADY, the Stopping Elderly Accidents, Deaths, and Injury. And we talked about that in one of the last webinars that I did as well. It's a wonderful, wonderful resource. And then the Morse Fall Scale. So the tool should contain all of the components of a fall risk assessment to be effective. So it's very, very important that it has everything. STEADY, I just love this, and in the references you'll find this information how to get to this website. But STEADY is wonderful with their brochures. They have one that is Staying Independent, learn more about fall prevention, and then what you can do to prevent falls, good brochure on that, and family caregivers, protecting your loved ones from falling, postural hypotension, what it is and how to manage it. A lot of times medications can cause that, so it's good to know. And then Check for Safety, which is a home prevention checklist for older adults. That's a very useful thing for those of us that are caregivers. So looking at the components of a fall risk assessment, first of all, you got to have a good history. That goes without saying. But if you didn't participate in the last webinar, if you go to shieldhealthcare.com and you look for the webinars, you'll see we went over a lot of these fall risk assessment tools. Excuse me. And I went through everything step by step of all of these components. The medication review, the physical examination, functional assessment, environmental assessment. So if you missed that one, if you're interested in that part, go back and look at that. It's called Screening Strategies to Reduce Fall Risk. And I gave a lot of information in there on how to do that. There's many risk factors that need to be looked at, like I said. Now, do they have a history of falls? This could lead them to being more fearful and less confident, resulting in more falls. So you need to look at that. Confusion. Are they over 65? Do they have impaired judgment? Do they have a sensory deficit? Do the medications cause them to be dizzy or sleepy. That can be a problem. Cooperation is a huge problem with the confused person. Some are just totally non-compliant, and it's very difficult to get them to work on not falling. Hurrying to the bathroom, that's a huge thing for people because a lot of times they will trip on the way or they leak on the way and then they slide in the urine. Dizziness, respiratory failure or respiratory disease or postural hypertension can cause that. And if they have an IV pole or they have any tubes or anything attached to them. And then, of course, there's the household safety hazards such as newspapers lying around and stuff like that that we need to watch for with our elderly. Okay, looking at the fall risk factors, like I said, there is intrinsic and there are extrinsic. Some are inside, some are outside. So some can be changed and others cannot. So if you look at this list, we're going to go through it a little bit more later, but some of these, as you can see, you can adjust. Some of them, not so much. So the most common risk factors, physical, behavioral, and environmental. Staying healthy as we get older improves our day-to-day life. And less physically active, the higher the risk of the fall. So keeping our elderly healthy is really, really helpful to decrease the fall. Strength and balance exercises are pretty important, along with managing their medications, along with regular vision checkups and making the living environment safer. These are all steps that we can take. Making sure that the environment is safe is key. It's one of the key things because those people that can't see well will definitely trip on things. Important things to look at. As people age, most will lose some of their strength, their conditioning, and their coordination, their flexibility, their balance. And when they lose those, it's primarily due to their inactivity. So the loss of those four things makes it easier for them to fall. As people age, less light gets into the retina, and it makes it very difficult for them to see contrasting edges, such as tables, coffee tables and things like that, tripping hazards, obstacles on the floor. And then meds. We really need to look at the medications for some that, again, may cause dizziness, sleepiness, dehydration, any that interacts with another medication we need to look at. And, most older adults have lived in their own home for quite some time. And so it's very important that looking at the simple modifications that you can make in their home to keep them safer to stay at home. And then the chronic conditions. More than 90% of our elderly have chronic conditions like diabetes, heart disease, arthritis. And oftentimes those will be increasing the risk of their falling as well. As well as the inactivity, which is a huge thing because inactivity for these people just causes them to decline. So, prior to having a conversation with your loved one or the family of somebody, of an elderly person, you want to educate yourself. Look at all the resources that you can and gather the information. It will help when you're talking to others about your concerns and have those resources ready. Nothing's better than pulling out a nice brochure or something and saying, yes, this is a problem. This is something that we can take care of. There's a number of resources available in, like I said, in the references of this program and the last one as well. We need to be very mindful how we speak to the loved ones or the family about the changes that you've noticed that pose a risk. You have to be mindful of your tone of voice, your body language, everything. It's a very touchy subject. Be considerate with the language that you speak. You want to speak in a very supportive way rather than a blaming way. So something like, I'm worried about you and I want to help. Instead of, you're going to fall if you keep doing that. They're going to go, no, I'm not. mean, it definitely, you have to be careful how you talk to people about their fall risk. This type of conversation, it may need to happen more than once because sometimes memory is a huge problem too. Not only with the elderly, but with, you might have to reiterate it several times. Sometimes the conversations about safety and fall prevention might be viewed as a loss of independence. And so you don't want your family member to, or your patient or their loved ones to think that you're trying to take away their independence, because that is very important for the elderly. Sometimes what can help is if you go to the doctor with them and have them go ahead and do their fall risk assessment. If a professional does that risk assessment on your loved one or your patient, it really helps to just kind of let them know, yes, this is serious. This is not just me saying you need to do whatever. So enlisting the help of the professional is very important. An action plan. Definitely start the conversations with the family members to enlist the support. Get everybody on board. Discuss all the health conditions with the family and the care recipient. You want to look at, do they have difficulty remembering their medications? Have they had side effects? Have they, is it getting more difficult for them to do certain things? Make sure they've had their vision checkup. And remember that the simple things like coming inside from outside with the lenses that darken in the sun, and then you walk into a darker home, that can be a problem for them too. Make sure that their bifocals are not a problem on stairs. If they have to go upstairs, that can be a problem. Watch for signs of loss of balance and strength and their gait. Are they holding on to furniture as they're walking? Are they holding on to another person? Do they have difficulty getting out from a chair? That's a good sign. Are they holding on to anything as they're walking along? And physical therapy might be a good thing for them as well. Physical therapists might suggest a cane or a walker or something, or even show them how to use them properly. And again, those side effects of medications, that's important to look at as well. So we're going to look at this safety assessment of the home. Doing a walkthrough is very helpful from start to finish. Perhaps you need to increase the lighting in the hallway or in the whole house. Keep lights on if they're getting up in the middle of the night. You want to make sure that there's 2 secure side rails for those stairs, because if they're using stairs. And then, of course, the grab bars in the bathroom, that's very important for them as well. Consider using a shower chair, too, with a handheld shower. That's so much easier for them to do than to take an actual stand up the whole time shower. Floors need to be clutter-free, no small throw rugs. You can use double-sided tape to keep them from sliding or folding, but we'll talk about that a little bit later. And watch the cords. Make sure that the cords are on the outer part, up against the wall and not across any walkways at all. Make sure that the chairs that they're using don't slide out from under them. I almost fell last night in my office at home. I went to sit in my chair. It's a little bit higher than it should be, and the chair went rolling out from behind me, and I almost took a fall. So make sure the chairs are sturdy too, because you don't want somebody sitting in a chair and have it break out from under them. Home modifications can be done. Most of us, we want to keep our loved ones at home. There's some modifications that can really help with that. First of all, they need to be able to reach those light switches and the outlets. So there's guidelines that are used for most condo communities. The light switches are no higher than 48 inches high so that they can reach them. And then the outlets need to be at least 18 inches from the floor. Doors are another modification that you can do to have them 32 to 36 inch clearance going through doorways. Very important. Window treatments can be installed with a remote control, or I've seen them that you just touch a little wand and it goes up and then you pull it a little bit and it comes down. Those are really easy for them to control. Low vision seniors, they may require up to 5 times the amount of light for average tasks. So it's very important to have light everywhere. One thing that's helpful is motion censored or motion activated light. That's a great thing to have in the bathroom or, other places for the elderly. Reducing the clutter in general is huge because you know what? They need to be able to navigate around the house without tripping over anything or, stumbling on their own newspapers is what I think of. So what does it cost to do this? We just built a house and we moved my father in with us, and I made sure when they were building the house to do some modifications that were available. For instance, during the framing, we had them put in the extra boards behind where the grab boards were going to be, or where the grab bars were going to be, and had them make a couple of doors wider than they needed to be, so that I'm anticipating, looking ahead, in case he gets in a wheelchair or whatever. Most of this should say the 50 plus, not 1950 plus, but the homes that are built for people that are 50 years and older. Most of the modifications are incorporated in their universal design from the beginning. So that's a good thing that they've actually started doing that. When the elderly move about, they need to have a straight path. Straight path, not going around a coffee table, not going around another piece of furniture. A straight path to that bathroom is what they need to have. Throw rugs or area rugs, again, I feel my choice is they should be eliminated 100%. And I'll tell you why. I'll tell you why when we get to the living room. But any wires, like I said, they need to be around the edge of the room or eliminated. And then, of course, your stacks of have you ever stepped on a magazine? When you step on a magazine, it's like stepping on ice. It just, page to page, it just slides and down you go. I mean, it's very, very difficult to walk around on magazines and newspapers. So, and elderly tend to like to keep their little papers and magazines right next to them. And so, yes, I've made sure that there's tables on both sides of his chair and he can stack his magazines mile high over there, but not on the floor. Entryways, a big deal, especially if they're with a walker or with a wheelchair, or if you're planning. Like in my case, I'm thinking ahead because when Dad is in a wheelchair, I want to be able to move him about. It's best not to have any steps. If you can possibly get away from steps in the entryway, that is great. The doors should be at least 36 inches, hallways at least 60 inches, and walking paths. We want to make sure that there's nothing in the way. Again, whether they're in a wheelchair or with a walker, it really helps to have stepless entries. On all doors, if you can, front and back, and the garage if it's possible. Kitchen, oh my goodness, kitchens can be so dangerous. In fact, in this picture, you see that the knobs for his stove are all on the right-hand side. That's much better than having them in the back. However, in the front, I have a new stove in our house, and all the knobs are right across the front. And I like that because I don't have to reach across there at all. And you need to really look at those types of things. Unbreakable dishes are really helpful. Pull-out shelves underneath, and having things mostly under the cabinets really helps because they can get to it, Counters should be the height that's easiest for them, and contrasting colors can help as well for the person with poor eyesight. I had a patient in Red Bluff many, many, many years ago, and she was wheelchair bound, and her husband did such a wonderful job. Her kitchen, she was in a wheelchair for many, many years. Her kitchen was built for her, and the sink was lower. She could wash dishes. She could get, her oven was down below. Her stove was lower, everything. It looked like a little kid's playhouse. But it was so neat, and she could do everything herself. And she cooked 3 meals a day for her husband for many, many years. The sink was recessed, so she could actually get up to the sink, wash the dishes, and could reach both sides of the sink. So it can be done, and he did it all himself. So he probably didn't have to spend as much money, and it was a very old house. But she took care of him. She cooked for him all the years until she finally died of kidney failure. But she was the neatest lady, and that house, even the bathroom, was made for her. So it can definitely be done. So for the aging person, you want a comfortable chair that has controls to lift the legs if you need it. And if they have trouble getting out of the chair, you may need to have a lift chair. But I got to caution you on that too, because when you buy a lift chair for an elderly person, they will use it. They will use it, and they will not get the exercise on their arms. So if you can delay that as long as you can so that they have to use their arms to get up, it may help to keep their arms stronger. End tables are much better than coffee tables. You can see the guy at the bottom. If he had a coffee table in front of him, coffee tables are the worst. They are the worst. When it comes to reaching things, when they're in their chair, have things like their tissues, a drink of water, and things without them having to get up and get it. It really helps to have everything right there for them. I feel that nowhere in the house with an elderly person living there should there ever be throw rugs, and I'll tell you why. First of all, if they want color and it's a hardwood floor or something, paint a rug on the floor. I've seen people do that so that it looks nice. But the main thing is, even if you tape it down, it's not going to slide out from under them. But when they're walking, a lot of elderly people shuffle their feet. And when they have their tennis shoes on or whatever, and they come up to the edge of even the flattest little rug, they can trip. And so that's why I do not like them. Sometimes they barely pick their feet up, and it is a tripping hazard. So my feeling is no throw rugs at all. And then pillows. You know, if you have some pillows around to where if they need to have offloading and you need to position them, that's a good thing to do. Or if they need to elevate their legs, you can put pillows under their legs. However, one thing to remember if you're positioning their legs, they need to have a bell next to them or something, because if they try to get up and those pillows fall on the floor, there you have a tripping hazard. And again, that lighting, adequate lighting is so very important for them. Bathrooms must have the grab bars. I mean, bathrooms are very dangerous places too. I've seen a lot of people that have fallen getting in and out of the bathtub or the shower. Grab bars need to be in place, not only in the shower, but if you can, by the toilet as well. Or they have some nice toilet bars that you can put on that connect to the toilet. You can take them off and clean under them and such. So I prefer those over the ones that you see in the picture here. It's best if you have a step-free shower for these people. It's nice to be able to just, walk into there. And also there needs to be a light in the shower as well. In the showers, you want to have the holders for the soap and shampoo. Okay, you want to have that level to where, or at their level. If they're going to be sitting in the shower, they need to be able to reach their soap and shampoo. In the second picture here, I don't like where their soap and shampoo is, because that person can't reach it. Now, maybe somebody's bathing that person, but I've made it so that everything is reachable. My dad can still shower himself, and he sits in a chair and he can reach everything that he needs to reach. I'm trying to keep him independent. Bathroom floors, you can make them slip resistant out of wood, vinyl, or tile. If they're tile, though, you need to have a lot of grout so that it, helps them to not slip. Counter height should be flexible, but 34 inches allows them a wheelchair to pull up to it as well. And again, the cabinets and drawers need to have levers instead of handles, because it's easier for them with levers. Comfort height toilets are a real help for people who have trouble getting up and down. And, you know, when they're weak, it's hard to get off of the toilet if it's too low. Lighting in the hallway to the bathroom and in the bathroom is extremely important so that they can, you know, get there in timely fashion without having to run. My little lady that I had, that I talked about before, her laundry room was perfect. She could reach everything. And these front loaders are great for people who do their own laundry. And of course, you want to have them on the ground floor of the house. You don't want to have them upstairs where they have to haul things up and down. In the bedroom, it's important to have the light. And if you ever heard my lecture on the elderly, on incontinence with the elderly, you would know that most falls happen on the way to the bathroom or in the bathroom. So it's very, very important that if they're incontinent, have them wear a pad at night, because then that keeps them from having to panic and hurry fast if they know that it's not going to end up on the floor, and it can keep them from slipping as well. It makes them more comfortable. It also, you know, will slow them down so they're not traveling too fast. Having a light by the bed is very important as well, so that they can get to that pathway to the bathroom. Slip-proof slippers. I don't even like the word slippers. I don't know why they call them slippers. I guess because you slip them on. But anyway, you need slip-proof ones that are not going to slide on the hallway floor. If they have a hard time getting out of bed to go to the bathroom, you might consider a bedside commode. That is very, very helpful for them as far as, you know, again, not having to hurry to the bathroom. These safety rails are great for the elderly to help them get out of bed, but also to keep them from falling out of bed. One thing I've seen in my career quite a bit of is injuries from falling out of bed. Not only trying to get out of bed, but bad dreams, boom, on the floor. But that bedside table is the biggest problem, because if it's sharp there, and I've seen some major head injuries from hitting the bedside table, hitting their little table next to their bed. It can be the corners on the nightstand can be a horrible injury. One lady that did that, I remember she bled so much she had to go to the ER and get a couple of units because she just bled so much when she hit there. She was trying to get a tissue. So again, if you have that next to their bed where they don't have to, you know, get up to get something in the middle of the night, it is better. So their clock, a lot of times they want their clock, they want their, you know, Kleenex, whatever you can put next to the bed to keep them from having to move around at night. Thinking about the Alzheimer's patient, or even just the memory loss, consider posting emergency numbers in several different areas, not just in one. And then smoke detectors should be all in working order and all alarms. So if they have the alarm system, you know, press the button and it calls the alarm or calls the company. Make sure you check those once a month. Make sure they're working well. And they tend to forget that they're cooking. So you can get appliances that have auto shut off. That would be good for somebody with Alzheimer's. And also, you could put colored tape or paint on stairways so that they don't, you know, so it brings to their attention what they're doing. People with really poor memories, you want to have their belongings in the same place in their home so that they don't, you know, forget. And you can also label and mark things so that they can remember. But since Alzheimer patients usually wander, it's important that, you know, it might help if you install locks that take a key, because that way, if they lock themselves in the bathroom, it's easier to get in. Consider placing the plastic covers on the doorknobs so that they can't open certain doors. Make sure they have an ID bracelet on and let your neighbors know, you know, so-and-so is a wanderer, and if you see them out for some reason, you know, I've even seen people hang a curtain over the door so that to the Alzheimer patient, that looks like a curtain over a window. and they may not be tempted to go out there. But it never hurts to prepare for that one time that they decide they're going to go for a walk without you. Cattail is, I'm not trying to advertise a product, but I will tell you that for us, when we were at the hearing aid place, my dad is basically deaf, there was this display, and it had this Cattail captioned phone, and it is a federally funded program regulated and monitored by the FCC, and it's designed specifically for individuals that have hearing loss, and it gives them access to a phone. What happens is that it works just like a phone, except that it shows captions of everything that the caller says. So they're actually reading that. And then, so you can hear them as well, but it's nice that they can just read it. And then there is, well, we also installed a flashing light smoke alarm for him because I really don't think he can even hear an alarm. So having that flashing light there, you know, he knows if that light's flashing, you need to get out of the house. So that's important. And also on this phone, it will flash when it's ringing because he can't hear the ring. So when the phone rings, there's a big light right on the right-hand corner that flashes very bright. I just hope he doesn't run out thinking it's a fire. But, yeah, the phone is wonderful. When we leave the house for anything at all, he is in his room with his phone. Fall risk for incontinence, I already kind of went over that, the slippery and wet floors, hurrying to the toilet. You know, one thing, though, that people need to think about is the transient causes of incontinence, because it may be a UTI. And then again, some of the medications can cause the postural hypertension, delirium, drowsiness, etc. So you want to really think about why is not just how to treat it and what pads to use and, you know, that kind of stuff, but why are they incontinent? What is going on inside their body that's making it so that they can't hold their urine? And nocturia is just so, it causes poor sleep. I mean, and it is associated with fall risk, of course, but the sleep deprivation is horrible when they're getting up every 2 hours during the night to go to the bathroom. So there is a relationship there, and you want to identify, like I said, treat it, and then watch for the side effects of treatment. If there is a possibility to respond to them quickly so that, you know, if they need help, they're not trying to get up by themselves, locate them closer to the bathroom. Consider a bedside commode or a urinal if they can't get to the bathroom on time. But important to implement a toilet assistant program. If you take a person to the bathroom every 2 hours or 2.5, whatever they can handle, their bladder will become more or less trained to being emptied every 2 hours, and it can save a lot of problems, including falls. So you want to really look at that. Ensure that they're wearing suitable clothing. You can do all kinds of things with, I've seen people use rubber bands. I've seen people use things that can, you know, help them get their clothes off faster so that they don't have to, you know, wait too long and leak. Consider that non-slip mat next to the floor so that if they do have incontinence, they're not going to fall. And then again, that pathway and absorbent products are very, very helpful. There was a study that was done in Osteoporosis International in November 2017, and the information is in the back of this program. But the patterns, it's called Patterns of Alcohol Consumption and the Risk of Falls in older adults. And I was amazed that those who drank in moderation were 21% less likely to fall, and they were 33% less likely to have a fall needing medical help, and they were 42% less likely to have 2 or more falls. So this is moderate drinking. And the Mediterranean alcohol drinking pattern, which is characterized by red wine consumption, moderate intake, and wine with meals, etc. Those things are not a problem unless it gets out of hand. And of course, they have to be monitored very carefully for their alcohol intake. But especially because they might forget that they drank already or whatever. So even though they show that it's a reduced risk to drink in moderation, it's a known fact that mixing alcohol with some of their drugs that they take, their medications, can be detrimental to them. So you got to really look at that, and you need to really monitor how much they're actually drinking, because, like I said, they can forget and take more if you're not watching. I'm going to go through this just very briefly, but there are fall prevention programs that are very helpful. One of them is for people who have lower risk falling. Tai Chi is really good for balance and stuff like that. They can, improve their mobility, their balance, their strength, their flexibility, all of that, and their psychological health by going somewhere and doing that. Matter of Balance, that's a program that is, it emphasizes practical coping tactics to reduce their fear of falling. And it has group discussion, it has all things like that. And then the Stepping On is, it offers strategies and exercises to reduce falls as well. It's a class that also increases their self-confidence. So really, you can look for these fall prevention programs. Now, the problem is, like with my dad, he's deaf. He won't go. He won't even go to physical therapy because he really can't hear, and it's embarrassing for him. Caregiving, oh my gosh, not only is, we need to educate our caregivers, and it can be so challenging, let me tell you. 1 in 5 caregivers reports high level of physical strain as a result to their duties. 84% say that they really need more information and help with caregiving topics. Caregiving is most commonly, caregivers want more information to keep their loved ones at home. And it is a difficult situation. The majority of caregivers help their loved ones with at least one activity of daily living. So it is a challenging job. It really is. 3 in 5 care recipients have long-term physical conditions. So care for the caregiver is extremely important. General caregiver reminders. Okay, you know what? I could write a book on choosing your battles, because some things are just not worth losing sleep over. Seriously, I am not going to argue anymore about the color of the sky, or whether it's going to rain tomorrow or not. These are things that, okay, if he wants to wear purple pants today, okay, that's okay. Allow him to make as many decisions as possible, because they've lost a lot of their decision making. They've lost control of their life. So letting them be human, letting them make those decisions is great. But address those spiritual needs with the elderly. So my little brother says it very well. He says, Dad's cramming for his final. And that to us is, he's asking these questions. What's going to happen? Am I going to see your mom when I die? How is that going to be? I mean, he's asking a lot of questions. You might need to have a clergyman come and talk to him, or just let them explore their feelings about their spiritual concerns, etc., because it can be very enlightening, and they can feel less pressure if we let them do that. It takes, some people say, takes a village to raise a child. I agree. However, I say it takes a village to care for the elderly. Honestly, it does, because the other healthcare professionals can be very helpful, and other family members can be very helpful, so don't forget to enlist them. Humans do thrive on affection, and I'll tell you, nothing helps them better than, a hug. Just a hug helps a lot. It's incredible. It's incredible what a hug can do. So, like they said, I've been a nurse for almost 30 years, or over 30 years now. And I've been a caregiver for my family, both my mom and my dad. When my mom died, it got a little bit harder with my dad. But I'm here to tell you, the more you love them, the more you get this caregiver fatigue. It's important to really, really get everybody involved. As our elderly men go through these adjustments from being the breadwinner person, the man of the house, the one who makes all the decisions, then they come with this memory loss, weakness, inability to make decisions. They go through quite an emotional roller coaster. So they really, really need to have that decision-making ability for anything that they can, even if it's, what do you want for breakfast today, Dad, or whatever. Give them that ability. So I'm going to just pass through this very quickly because we are out of time. But remember to choose your battles wisely. It is very important to let them make decisions. So care for the caregiver is important. Watch when you are overwhelmed. Take care of your own needs. Work as a team, because if you don't, you will get what we call burnout. So some very important key things to remember: multifactorial interventions that can address many predisposing factors. So you want to look at that, and that falls are common and have reverse or adverse consequences, but they can be preventable, and that the current guidelines specify that primary care providers should screen older adults for falls. So don't forget that your PCP has to do an assessment of your elderly as they come in. Medicare actually pays for it. So remember that many falls in the home and related injuries can be prevented, and there's the 4 things that are very important for you to do to prevent it. There's resources, like I said, about caregiver fatigue. There's senior companions, adult daycare. All of these things are available for people that need help. So if you have a patient whose family member is getting really, really fatigued, hook them up with some of these online. They're easy to find, and they're also in the back of this program. These are some of the agencies that are very good educational resources and have a lot of information on how to take care of the elderly and to prevent falls. There's references available here. You can go online and find a lot of information, which is basically what I did. And that's the end of my part of the program, and thank you guys for being there. Thank you for listening, and I hope that it's helped you with your patients and or your own family members.
All right. Thank you so much, Kelly, for the wonderful presentation. We really appreciate it. We're going to go through a few more things, but in the meantime, everyone listening, if you do have questions, we'd be happy to get to them, so please type them into the question box on the right-hand side of your screen. As the slide shows right there, those who registered as healthcare professionals, CE credit certificates will be emailed to attendees within 7 to 10 business days. If you do not receive your CE certificate, please check your spam folder and contact us at marketing@shieldhealthcare.com so that we can assist you. All right, next slide, Kelly. Thank you. I just wanted to call to attention our community site, which is at shieldhealthcare.com/community. On this site, we have more than 2,100 articles, videos, and lifestyle resources, many of them composed by some of our lifestyle specialists, such as Aaron Baker and Lauren Cox. We also, on the site, have information for parents of children with special needs and much more. So when you do have time, we welcome you to explore our community site for some really helpful tips. Next slide. All right, we have our 18th annual Caregiver contest. We are approaching the final week. It actually ends next Friday, January 31st. We strongly encourage you to submit your responses, and you can enter for a chance to win up to $250. So a really great way to recognize what caregiving is all about. This year's topic is, what are your tips for finding life balance as a caregiver? So I imagine a lot of you folks have a lot of good insights, and I'm sure Kelly would as well. In addition to our community site, we have a lot of great resources out there. The ones you're seeing on the screen range from living well with an ostomy to our wound management guide to things like our living well with incontinence and also aging safely at home. Should you like to receive any of these booklets via PDF, you can request them on shieldhealthcare.com/community. All right. Well, thank you guys very much for attending this webinar. We do have some time for a few questions, and several of them did come in while we were going through this last brief moment. One of the questions that popped out, Kelly, is we have tile floor right outside of our shower, and it's pretty slippery, and we currently have like bath mats. Do you have any suggestions for making it safer?
Yeah, there's several things. First of all, you definitely, if you've got a bath mat there, you want to have one that is not going to slide. That's what I would do, is get an actual bathtub mat that will stick to that tile so that it doesn't slide. However, the other thing is, if it's tile, it needs to have, I don't know if they can now, but needs to have more grout so that it got a little graininess at least somewhere so that they don't slide. I'd be very, very careful with that. In fact, you can even get that that type of rubber that they have in playgrounds that is mushy, but yet you can't slide on it. I would be tempted to even put something like that down if they're getting out of the shower, and make sure that the grab bars are available right there where they can get out of the shower without, you know, and hold on at the same time.
All right, thank you for that. Do you have, Kelly, or do you have any, is there a guide available to identify contractors or folks who could help perform some of these installations for these home modifications?
You know, when I did the research for this program, I was looking online. There's a lot of information on remodeling and a lot of information on what you can do to revise a house and make it so that it's, you know, less of a fall risk. So I would imagine that once you look at what you need, you could actually get just about any contractor to do it. I've seen people that you know, take out an entire bathtub, have just a handyman do that, and put in a walk-in shower. As long as you know what you need, you can find somebody to do it. There probably are people out there that specialize in that. I didn't come up with any, you know, right offhand, but I wasn't looking for that. But just the modifications themselves, a lot of it you can do yourself too. But I would hire it done.
Great to know. Thanks. Great advice. Next question. My spouse doesn't lift his feet when walking. How can I help him raise his feet? We use carpet around the apartment.
You know, that's kind of hard because it depends on why he's not lifting his feet. If he's got Parkinson's or he's got neuropathy or, you know, something like that. I have the same problem with my dad because he has neuropathy and he can't tell where his feet are. His proprioception is gone, so he slides his feet, which is why we have 100% waterproof laminate flooring. It's got a roughness to it, so it doesn't slip when it's wet. You can't slip when it's wet, and I would suggest, that's just me, I would definitely suggest getting a different type of floor if they're not picking their feet up, but have no throw rugs anywhere, and just making sure. I mean, you can't really, you can remind them, but I would also make sure that they have good shoes on, because there are some shoes that have a very, very gripping bottom on them, which most tennis shoes do. So that's a little difficult on carpet, and they will actually stub their toe kind of, and they can fall that way. So if it's on carpet, I would have something that actually would slide a little bit without having to grip really hard. But if it's on a hardwood floor, tennis shoes are wonderful on a hardwood floor. So it's kind of hard because it depends on why they're dragging their feet.
Thank you. Possibly, this might fall in a similar category. I frequently fall even from a standing position, and curbs really frighten me. Do you have any suggestions for any exercise to help alleviate this?
Read that question again. Is it because of balance?
The participant says, I recently fell into this category with falling frequently, even from a stationary standing position. But curbs still frighten me. Any suggestions for exercises for these fears?
You know, the first thing I have to say is I would find out why you're falling. There needs to be a workup done. You know, is it dizziness? Is it some of your medications? Is it weakness? You know, what is causing the falling? I would go and have a doctor's appointment and have that checked out and see what they come up with. They would probably, any physician that you see for falling like that is probably going to order physical therapy. Physical therapy will give you exercises for balance, but I can tell you that I wouldn't start any exercises for balance without seeing a physician first, because you need to figure out why you're having that. If it's weakness, or if it's could be a heart, could be dizziness, could be medication, could be a lot of things. So I would definitely go have a workup first and find out what the issue is, and then work on the exercises with a physical therapist.
Great, thank you, Kelly. Next question we have is walk-in shower rails. Are they horizontal or angled?
It depends. I have one that is vertical, and then I have in all of our bathrooms, I have the horizontal ones. Some people like them to be angled. I don't know the criteria on that. I don't know if there is some reason for that, but ours are straight. And but I do like having that one vertical one that is right outside of the shower, so that when the person is getting into the shower, they have that to hold on, because I have about a 2-inch or 3-inch step that has to, you know, he has to go over, and holding on to that helps with getting over that step. And then the other ones are completely horizontal. And I don't know, I didn't see anything in the literature that, and I wasn't looking for that, but that says that they should be angled. Some are and some aren't.
Great, thank you. We have one last question here. States, I have several at-home clients who are currently using the sink to help lift from the toilet. Any tips on explaining the risk associated with this to clients?
You know, it's very dangerous, especially if it's a freestanding sink. You don't want them grabbing on that. What I would suggest is the bars, the hand bars that are next to the toilet, like I said, they attach to the existing screws on the back of where the toilet seat is attached. And it's very simple. Undo those screws, lay it in there, and do them back. And then they have the handles that you can actually lift them up to clean under them and stuff like that. So very helpful. I would not suggest they use the sink, and if they are, I'd put those bars in and teach them how to use those bars, because they will use the sink unless you have bars there that they can use. If it's a freestanding sink, though, that's a very dangerous thing. Very dangerous. It could fall, come loose, and they could get hurt. Plus, it's not safe because it's slippery. If their hands are wet or the sink is wet, you know, they can slip off and fall anyway. So I get those bars next to, if the toilet's close enough to the wall, you'd put a grab bar next to the toilet. But if there is not a wall next to it, then I would definitely get those rails that are on the side of the toilet. Very easy to put on, very easy to find. So.
All right. Well, thank you for that insight, Kelly. We really appreciate it. And that concludes our webinar for today. Thank you everyone who attended the webinar, and definitely thank you to Kelly Sparks and Capital Nursing for putting on such a wonderful webinar. Thank you again for attending. Again, once again, this webinar will be available on our website by the end of the week, and we'll see you next time. Thanks so much.
Thank you. Bye, everybody.